Hello and welcome to my channel. So today I just wanted to chat about getting back to activities postpartum. I know that it's pretty much common standard practice, if you will, for you to go to your OB appointment follow-up and then they just kind of like clear you to go back to normal. And they usually say something like, listen to your body as you get back to things. If you're lucky, they'll also say something like, avoid XYZ increased symptoms. Sometimes they'll offer you a referral to an appropriate specialist, but more often than not, that's not really the case. So it can be a little bit confusing to know like what's safe to push, what's not safe to push, and a ton of different factors can build into when is it appropriate to do more things. So a couple of really common things that you do not want to push through are increased bleeding in those early weeks, or I guess later if you are still bleeding. And then really commonly people say like heaviness in your pelvic region. So my question then becomes, we all say that like everyone knows what they're talking about, but how do you know what heaviness in your pelvis feels like? So with that, we'll jump into that in a minute. But the other piece that also sometimes people will say, sometimes they won't, is you don't want to push into feeling incontinence. So incontinence would be leaking, either urinary or on the back end on that poop side of things. If you experience either one of those things, especially with exertion, that's not normal, even if it's common. And that's where getting a pelvic health referral for physical therapy is definitely recommended. Honestly, for any of this, requesting a referral is a really great way to go, especially if you are wanting more individualized care than just what you can find on the internet. But that's kind of like person to person. So pelvic heaviness is kind of like cramping meets soreness meets fullness. You might feel like you have to pee or there's a lot of pressure. It's a little different than like regular muscle like soreness, and it's a little different than period cramping. If you aren't sure if you're experiencing it, that's also a good thing to like shoot an email to your provider about, because they should be able to give you a little bit more clarification. And then touching on the bleeding. So some people don't know this, and I actually didn't know this until my OB said it, and I'm really glad she did. But you go through your initial phase of bleeding and it kind of like tapers off, because this is not exactly what it is, but you can think about almost like where that placenta came off, you had a scab, or you have a scab that's formed. And then as you're continuing to heal, now you have to like shed that scab. So you can think like if you have a cut on your leg, it bleeds, it scabs over, then your scab starts to come off. But if you pick at your scab, it's harder for it to heal. So we want to make sure that we're pushing ourselves appropriately, but not overdoing. This is not the time for setting records and no pain, no gain. Like, you will get back to your things. It just might take a little bit longer depending on what's going on with you and what type of birth you had. And so that brings me to my next point. So another factor that hugely impacts recovery is what type of delivery and birth experience you ended up having. So if you ended up with a relatively uncomplicated natural or vaginal birth, you theoretically are recovering a lot more quickly than if you had a really long labor, if your kid was flipped the wrong way and they had to try and flip him, if you had a really long labor and then you ultimately ended up with a C-section, if you went in with a planned C-section. So all of those things will impact your healing and recovery time. So let's talk about the uncomplicated, kind of easy first. So uncomplicated meaning you didn't have a lot of tearing or any tearing. You had a relatively straightforward pregnancy and you were actually able to stay active. Your OB is probably going to clear you, or probably should clear you, to get back to like normal really quickly, actually, compared to kind of the average standards. So in my experience, I was fortunate enough and I made a lot of calculated choices to try and set myself into that camp. And it did all end up working out that way, more or less. My whole labor start to finish was around about 29 hours. While I did have interventions like an epidural, I didn't have any other interventions, and I had basically an abrasion versus actual tearing. So with that, by the time that I saw my OB around about that 3.5 weeks post-birth, She actually checked in, asked me a bunch of questions, and based on my responses, I was cleared to go and begin all my normal activities. Luckily, I'm a physical therapist, so I kind of know what that is, and I was able to push myself appropriately. But that can be kind of shocking if you're thinking like, oh, well, my sister or my friend, it took a really long time, and you're expecting that to get cleared sooner is a little bit odd, potentially for some people. On the flip side, you could have the opposite experience of my sister, my friend, whoever was cleared after 3 weeks, 4 weeks, 6 weeks. Like, how come I can't get back to the things? So we'll touch on that next. Okay, so this would be you had a planned C-section. And with that, you want to remember, and this applies to the unplanned C-sections as well, that this is a surgery. They literally have to like put you under to some extent and cut out your baby, which means they have to cut through your abs and a bunch of different tissues, including your uterus. The good thing about this is because it's planned and your doctor's actually in there performing this, they'll know exactly what happened and they should have pretty specific follow-up for you there. That being said, our bodies are generally pretty good at healing and getting back to normal. So definitely I would recommend a pelvic floor PT referral in this case, and ask a lot of good questions like how long until you can XYZ whatever, what's standard healing times, what can you be expecting to do postpartum. You also want to remember that even if you had that C-section and you didn't end up with that vaginal delivery, your pelvic floor did still have to undergo all the changes in load, as did your pelvis, as did your abs. So you want the referral on that side of things, in addition to managing your scar and all that sort of stuff as well. Typically, we would expect this to take a little bit longer to heal up, but if it's like a straightforward, uncomplicated C-section, it shouldn't be taking too long there either. Okay, so this third category is whether you were induced or had spontaneous onset of labor, ended up getting a C-section. With this is a very, very variable category because some people pop back out kind of aligned with the C-section I just mentioned. Sometimes you were in labor for up to several days. Maybe you underwent distress, maybe your baby underwent distress, maybe they tried to flip them and they couldn't, maybe their umbilical cord was not in an optimal position. So many factors that led to that ultimate decision of your C-section. You can think about it this way. Because you tried to have that natural birth, you have all of the ramifications of that. And then because you had the C-section, you have all the ramifications of that. That being said, this also may end up in that category where it's like, oh, this is relatively quick or straightforward from a healing standpoint, or it may take a little longer depending on how emergent things were, hemorrhaging, which will always play a factor no matter what type of birth you had. So a lot of different things. It's ultimately really helpful to try and nail down specifics from your OB, and they should be able to answer these questions for you. So what happened to me? What would we expect as far as healing time? What should I absolutely not be doing? And what is okay to do? When can I start doing more? Even if you don't really have aspirations of like getting back into the gym or running or biking or ice skating, like whatever things you did before, you do need to get back to like your baseline normal, which still takes some work. It took 9+ months to get this way. It is going to take time to get better, but you also have to actively try to get better and get yourself back to normal for the most optimal outcomes. Once in a while, someone's really lucky and everything just popped back to normal and they did no work. But really, if you're like, I want to guarantee that I'm kind of back to my prime functioning status, it is going to take a little bit of work to get there. So now that we've talked about briefly different types of birth and kind of how quickly you might be cleared back for activities, I feel like it's really important to set yourself up for success. And some of this is actually relatively passive, so to speak, things that we're wanting to do in the beginning. So eating appropriate food, both volume, quantity, type, drinking enough water, same thing. If you don't love water, like sports drinks, the little like hydrating tablets. Like I use Noon. I use that for running. It also works really well just when you're thirsty and nursing. All of that can play a role. Sleep. Sleep is so incredibly important. And everyone always says like, sleep when the baby sleeps. And you're like, yeah, I have laundry, I have dishes, I have XYZ, whatever. You just went under this huge endurance activity of giving birth. Now we need to recover. We need sleep. That's how your body heals. So if you can have someone come and just keep an eye on the baby while you nap, if you're stressed about sleeping while the baby's asleep. I was lucky enough to have and planned it, so it was kind of lucky, but I asked my sister come and stay with us for a few days, and that was so spectacular because it meant we could get some sleep. In-laws are a great option. There are other various in-home care options if you don't have family or someone you can rely on in the area. Maybe making a game plan with your spouse of like, you're up for the first 4 hours, I'm up for the second, if that's an option, or your partner, maybe a best friend. So really, food and sleep are key. The next piece is actually just starting to work on breathing and tuning into those abs again. That'll be a separate video, but just know that that's a thing, as well as what's happening as far as bladder, bowel, bathroom habits. So it can be really like traumatic to try and go to the bathroom initially. That's why a lot of times your doctor will prescribe like stool softeners, and that's why you'll hear a lot of pelvic floor PTs and you'll see on the internet about like pushing, straining. We don't want to do those things. So making sure that we're not forcing anything out down there, we're just kind of relaxing and breathing through it. Your final piece is actually scar management. So if you had any tearing in that vaginal area, making sure you're using your peri bottle and kind of checking in on that, letting that heal up. If you had a C-section, same thing, keeping an eye on that incision. We don't want that to be reopening. And there's a bunch of different things, which also I'll have a future video on as far as scar management and setting yourself up for success there. Okay, this is a little bit more like ancillary, fun sort of, maybe, stuff. So if you are nursing, or even if not, if you're pumping, whatever you're doing, your chest size has likely changed. Make sure you get appropriate fitting sports bras. Make sure you're not hanging out in that compressive stuff. But for me personally, how am I supposed to go exercise if I don't have the right clothes? Like, I am not going for a run if everything is jiggling around. So even though it was kind of early days, that was something that once my chest size seemed to stabilize, I was like, I need to order appropriate nursing athletic sports bras. That way I'm prepared for when I am able to do the things. Let's eliminate those barriers. So make sure you have clothes that fit, things that feel comfortable, and you're gonna need them for a little while. So go with that. It's important. Same thing with like buying nursing clothes or whatever. Like I tried to pick things that were multitasking that'll get me through a long time, but I was also like, hey, my body's still changing. I'm not just hopping from pregnancy back into regular clothes. Let me find things that are gonna fit and work appropriately. Something else that I would recommend too is potentially you had this during pregnancy, but if you had like supportive underwear, you want to maybe be able to wear those postpartum too. There are some good postpartum brands as well as pregnancy and kind of hybrids that'll do both, because everything just got really stretched out. Now it's kind of like loosey-goosey, jiggly, half-set jello, and having that compression to help kind of promote things is good. Some countries, it's kind of common practice to bind or kind of brace up. If you had a C-section, you probably got a wrap or a brace. But if you didn't, that can be a good option. I know sometimes people are concerned and they say like, oh, we want your muscles to do all the work, but like your muscles just did a bunch of work. That's like saying, oh, I sprained my ankle, but I'm going to keep walking on it without a brace for a little bit. There is a time and a place. And that's something you could talk to your care providers about as well. Otherwise, do some sleuthing. There's a lot of good brands out there that have decent explanations on their websites as to what stuff and why. I tried a binder. It didn't really work out for me super well, but the supportive underwear was definitely a thing. And I've actually worn that through the postpartum journey as I've increased exercise intensity, just to give my body that little bit of extra support. Okay, one other factor that's huge when dealing with recovery postpartum is, how was your pregnancy? What did you do during your pregnancy? Did you sit on your couch for 9 months? Were you puking every single day? Were you at work in a demanding job? All of that matters. Did you keep working out? Did you keep running? Did you keep lifting weights? Did you keep doing your sport of choice? And what sport was it? How long were you able to keep doing that? All of that matters too. So for me personally, my goal was to keep my running training as close to normal as possible. So in this case, normal does not mean what a lot of people would think. It meant prioritizing getting in some speed work, getting in a long run, and also still having those appropriate recovery and easy days. With that, I still kept my twice a week of speed works and my once a week long run, but my volume by the end was down to like a half, maybe a third of what it typically is. Time might have stayed kind of similar because I added in a lot more walking. And then I did do pregnancy safe, appropriate core workouts. I kept lifting weights. Actually, early on, I was like, oh, I need to get back on my weightlifting train of things I've done before, but I haven't been doing right now to make sure to keep everything going. So because I was able to stay active for those 9 months and then had my baby, had a straightforward delivery, really I was kind of like recovering for that month or so, doing a little bit of stuff, still walking around, good form, reactivating and tuning into my core, all of that, breathing, syncing, walking, doing some running drills. There's all these pieces that went back into it to make it so that I could return to running. If you, on the flip side, ended up with a pregnancy where you're like, okay, I only ran for 6 weeks or the first trimester, and then I had 2 trimesters where I didn't or couldn't, it doesn't make much sense at week 6 to get cleared and go, okay, I'm going to go and do exactly what I did. Like, how many weeks ago? 24 plus 6, so like 32, like over half a year ago. Your body's not in shape for that anymore. So you want to build back up appropriately. And unfortunately, we'd love for that not to be the case, but your body was just really busy growing and having a kid. So you want to make sure that you intelligently progress back. So for me now, as I'm progressing back, same kind of thing. Prioritizing my appropriate speed work, so it's not the same volume, intensity, anything as before, and then prioritizing my getting back into that long run, as well as my daily movement. So you really need to kind of think about what's important for you and then take intelligent steps to build back. And if you're like, I actually can't do that, you want to find a provider who can. So postpartum PTs could be really helpful. Usually pelvic floor therapists are pretty good at this. Strength conditioning therapists could be good at this. You might actually find success somewhere else with a little more targeted of a program. But you are wanting to make sure that you understand what you're doing and why you're doing it. I could go out and run way too far right now and hurt myself, just as you always could. Don't do that, please. Please take appropriate steps and reach out to the appropriate providers. If you don't know who that is, do a little bit of digging. Otherwise, feel free to chat in the comments and I'll get back to you as quickly and when I can, if possible. I'll also try to put some great resources in at the bottom of this post as well. So moral of the story, much as we don't love to hear it, yes, everyone's journey is different. So making sure that you're doing what feels right and appropriate for you, but that as you're doing things, you're making smart, intelligent choices. And this can be a little tricky for people, especially when there's all these like mom pressures, baby pressures. We're girls, so we all like to judge and care about everything else and people's opinions. But knowing that you're making the right choices for you and making the right choices for you are both incredibly important. And knowing that there is a spectrum, and based on your experience, you're landing somewhere in that spectrum, and now we're recovering appropriately for that place. It's the same as like shoulder surgeries, knee surgeries. Some people bounce back really quickly. Some people takes a little bit longer. Setting yourself up for success is really important, and knowing the current evidence, research, all of that too. Hopefully that's something that your care providers do offer, but usually that is something you can look up online relatively easily too. So hopefully you found all of this helpful and a little bit reassuring one way or another. As always, feel free to like, share, subscribe, and in the comments, feel free to pop on with any other things that you either wish I've discussed or topics for future discussion. Obviously, feel free to share your experience as well. I love for this to be a nice, open, inclusive place, and I'll see you in my next video.